Okay, ladies and gentlemen, I have the pleasure to participate in this conference, and I would like to thank you all and thank Megan, who recommended our organization to be a member of this PTD. Actually, we first heard about PTD from Meet Magna. I would like to share with you our experience in managing human resources in the Central Medical Supplies Public Corporation, and my finding is a little bit different from the title of the talk. But anyway, I'll share with you how we managed to develop and take our business forward. The Central Medical Supplies is a public corporation, has been established in 1991. And being a public organization, its staff and workforces is governed by the Civil Service Act of 2007. And this is a real challenge, and I'll talk later about this, which is clearly that being a public organization, as a director or as a manager of the CMS, you have no role in hiring and firing the people, because you have to follow the long process of the civil servant. And the challenge is that how you can change or how you can get maximum possible from people who you cannot hire them or you cannot fire them. This is a real challenge. And I think yesterday was some talk about the social leadership and this kind of things, where you have, it is better to lead people rather than to have authority on them. And this is typical what we have done in, and we can see from the slides that you need, in this case, because you have no control yourself, and even some of staff coming from other ministries of health, from the pool of the public health, of the public employees. So you need to lead them. But, and from our experience, what we have done is how to motivate the staff and how to empower them and training them, giving them incentives. It's not necessarily the money, but other incentives, and I'll share with you all these factors. So our turnover is around 125,000 million US dollars, and the number of employees is more than 400. We do the typical function of the central medical stores: procurement, storage, distribution. And this is a category of our staff. We have pharmacists of 53 pharmacists, and we have also biomedical engineers, because we also do this medical device supply, and we have the administrators, laborers. But the 5 categories in red color, these are people who have no authority on them. They just come to us from the pool of the civil servants in Sudan. This is accountants, which is the main part of the central medical stores. Also, we have internal auditors, we have storekeepers, and the legal advisor, and even the head of the personnel section. So these people, they just distribute them or deploy them every 2 years, or sometimes even every 1 year. So you can't invest in them, but I'll show you how I'll share with you our experience, how we can get maximum from this kind of stuff. This is our organogram. Our organization is the Board of Administration Board, chaired by the Minister of Health, and the Undersecretary of the Minister of Health is a member, and also Undersecretary of the Minister of Finance, and myself, and 4 different departments. And I think this is very, I don't need to spend more time on it. But one of the questions, because we have this central level and state level and also locality level, and we have, because constitutionally you have no role on the states, you have fully decentralization system. But one of the, in the same way we're responsible for to distribute medicine down to the bottom of the supply chain, even to the health facilities, but through the state programs. Then I'll share with you how we convince sometimes the ministers at the state level to recruit new staff. And this is actually, we have a model of organogram for the state Ministry of Health, and that with clear functions. You need to every box in the organogram, you need to specify the function and people who in this department, what they do, what is the task, what is their job description, and all these details. And also you tell them the budget. And sometimes we seek experts' opinion to convince people. Terrain and capacity builders that we deal with them during in our reform program. Actually, we have a very comprehensive reform program to CMS itself. We started in 2011, and this is a good opportunity to share this experience with our colleagues in different organizations in similar settings. And this is, could be, I think, easily downloaded from our website. We do training with, or we have cooperation with certain organizations from within Sudan and outside. And this HERA is a Health Research Action Foundation from Belgium. We have a cooperation agreement or memorandum of understanding. They help us out actually in evaluation of the CMS performance and set a very good 5 years plan. Have also a memorandum of understanding with the National Center for International Health, and then they do the training gap analysis just in May this year. And also Axios is an American foundation, and this is contracted by the Global Fund, and then they stay with us for contract for 3 years, and they do a lot of training of trainers at the bottom of the supply chain and the state level and locality levels. We have also continuous professional development program in collaboration with the Sudanese Pharmacists Union, and there is a fellowship program, and my colleague Sarah here is the secretary of that program. This is a fellowship program, give postgraduate studies certificate from National Institute of Sudanese Medical Specialization Board, and graduates of this fellowship program, they can be registered as specialist pharmacists in the Sudanese Medical Council, and this gives them a chance to be promoted for a higher scale in the civil service. We also have resources for training and development of our staff in the CMS, and I'll show you in the coming slides these resources. We also deal with Crown Agent I+ solutions in their participating in their courses conducted overseas, and sometimes we invest as guests from outside to do some trainings in the country. These are the areas of the training. All of the supply chain stages, quality assurance, procurement, and even for management and computer skills, accounting, and human resources development, all this field we have trained our staff in this. Training methods, as we all know, there's a mix of the training, self-learning, and online self-training, and we benefit a lot from the GSI online, this course of logistics. And actually, we set a group of people and open the and go through the topics one by one, and then we sit to discuss them on a weekly basis. So we found it very, very useful, actually, course. This is online course, and there's also other online courses we benefit from them, in addition to the long studies like MSCs, PhDs, and this. And also, we benefit from the external courses, and this is one of the incentives we use to motivate our staff, that it's not exchanging their experience, but also traveling around and see and change experience with the participants in the international courses. We found this very, very useful, actually, and they conducted like 30 minutes presentation to their colleagues when they come back from these courses. This is our resources. Actually, I'm not sure, maybe most of us from developing countries benefit of this HINARI, Health Internet Network, access to research initiative. I think and this is a database run by WHO and other organizations, and you have access to more than 13,000 journals and more than 25,000 electronic books, and we found this very useful actual resource. And this also Sudanese continuous professional development for pharmacists, and we also to update our people with the medicines, new medicines. We used to distribute this British national formula for our staff in the CMS and in all supply chain in the States, and even for the regulatory authorities. And this for us is a very important book. In addition to the international price indicators, we also in Sudan, we use this British national formula as indicator for the price, especially for the brand products. We have also this yellow book, MDS, Managing Drug Supply and Managing Access to Essential Medicines and Medical Technology. And we have a story with this, I will mention it later. Now we proposed a regional training center. And this center, we already contracted the constructor company and by next year, by October next year, we move in. This is our output of our training programs, and you can see clearly we started actually from 10 employees trained in 2010 locally in Sudan to more than You can see more than 330 in the first 9 months of the 2012, and I'll show you the outcomes of this, of having trained people. And the budget for this training program increased from around 90,000 US dollars in 2011 to more than $650,000. And how we convince the people in the Ministry of Finance to get this money, this huge money to develop stuff. This is a story that I will share with you. You can see the outcomes, and this is how we convince them. I have five indicators. One of them is the availability of medicines, and you can see in 2009, at that time our country is one country. There is oil, there's a availability of foreign currency, but in 2011, then there is a country separated in two countries, oil gone with our colleagues in the South Sudan, and we remain with the very scarce hard currency. And this is to show you how you can get the maximum possible from the staff, the same number of staff, the same people, but we motivate them, we make them very enthusiastic, and we lead them to reach this level of availability. Also, there is a sanction is very heavy in 2012. The evaluation, the exchange rate changed from 2 Sudanese pounds for $1 to now 5.6 Sudanese pounds for $1. But still, we managed to increase the availability of medicines. Also, this is a registration of medicines. Before 2010, we buy non-registered medicines, but we shifted to only registered and to focus on quality and obeying the laws of regulations. And you can see the number of registered medicine in our warehouses increased to 98%. This is the outcomes of getting registered medicines. The rejection rate of the samples sent to national lab for testing reduced from 10 or 16% on average to less than 1%. And the expiration rate, we convince people in the Ministry of Finance that because our monthly stock average is around 60 million US dollars. So we said, if you do not allocate budget for training, then you're going to lose this money. From 7%, we drop to less than 1%. And the reconciliation of the recorded stock and actual physical count, the deviation dropped from around 2% to 0%. So what challenge that we face in the central medical supplies? Actually, the recruitment of staff, being a civil service or employees, you can see, you just say, I have a vacant, and then there's a commission who do all this on your behalf. We as an organization, we do not participate in the selection, in the interviews. All this business is done by other people. Training needs and performance assessments also, we need to integrate the training in the CMS strengthening program. Continuous professional development, we need to move forward on that topic. Establish training center, we already mentioned it. We need to also, one of our challenges is staff turnover, and the employees who are not from the CMS, like those who come from other ministries and move, we need to find solutions. And one of the very important things before leaving is the economic sanctions. And now we cannot even do bank transactions. Sometimes we fail to do this bank transaction, and we couldn't participate in courses because we couldn't pay in cash, and we couldn't do this bank transaction. This is one of the challenges. And even some medicines, we couldn't get them. And even the books, I think there is no time to tell the story of the yellow book. And one point, the last point is how we can, I think from our experience, how we can find internationally recognized postgraduate degree in supply chain. This will be very helpful for all of us, I think. Thank you very much.